Heart disease is still the #1 killer in the U.S. In fact, this year doctors will diagnose 670,000 Americans with heart failure. This diagnosis is devastating because currently half people who develop heart failure will die within 5 years. Here with more on this national health crisis is Dr. Jerry Estep. Doctor, good morning. So great to have you on the show this morning.
Good morning, Stephanie. Happy to be here.
So this is pretty devastating news. Heart failure still remains the #1 killer of Americans. Talk a little bit about heart failure and maybe what it's like for patients living with it.
So yeah, heart failure remains devastating, and it accounts for the most common cause for hospitalization in patients over the age of 60. And over 5 million people in the United States have heart failure. And so it's a condition where patients have shortness of breath and/or fatigue. They have signs of fluid congestion. It really affects their ability to get around. And unfortunately, when they're hospitalized, there's up to a 25–26% chance of dying over the ensuing 12 months. And unfortunately, at the onset of the diagnosis, about 40% of patients will die within 4 to 5 years. So this remains alarming despite advances, and we have guidelines and devices to help us, but unfortunately for many patients there's continued progression.
Right. I mean, it really is heartbreaking. You know, my grandfather is currently living with heart failure right now, and I've got to say, as a family member, like I said, it's heartbreaking. Can you speak to maybe from a family's perspective how it's not only affecting the patients but family as well?
Yeah, no, I appreciate your comment, and this deadly condition unfortunately affects the patient, caregivers, and what it means in terms of the breathlessness and the need to be in clinic or unplanned need for emergency room visit or hospitalization. What patients require their loved ones and friends to help them through this condition that affects their everyday livelihood. And so really it affects the whole family, and for us as heart failure providers, our aim is to use the medicines and devices we have to provide a better quality of life and a better outlook. And we're thinking always in terms of prolonging life for our patients.
And speaking of those devices and learning more about technology, I guess the good news out of this is that we do have leading experts around the country really having eyes and putting focus on this. And you guys are actually going to be right here in Florida, in Orlando, right?
Correct. We are here in Orlando at our Heart Failure Society of America meeting, where researchers, trainees, heart failure providers, from nurses to cardiologists, sit down and we talk about the latest clinical trial results, research results, best strategies to treat these patients that are present in different stages. And so we're very excited about the new cutting-edge technology that allows us to help our patients.
Well, is there anything, as we close here, Dr. Estep, that maybe our viewers can do, that we can do to help? If maybe we can, you know, if there's anything that we can do to stay above heart failure to kind of contribute to this?
I think it's awareness that those patients with high blood pressure, diabetes, blocked arteries are at risk for heart failure, and being very sensitive to these symptoms of breathlessness or fatigue. And there are clear advances with medicines, and in particular with devices. And information can be found at acc.org and heartfailureanswers.com. And I would want your audience to be familiar with these options.
Thank you so much for helping spread awareness today. And as you said, we've got that website right there. And if you guys are listening and you want to learn more about what Dr. Estep spoke about, head online to our website. We're going to have all of this right there at fox4morningblend.com.